Hi folks, this is David Villar and welcome to this video on a specific non-steroidal anti-inflammatory drugs. We already talked about general mechanisms of action and characteristics of this group of drugs in previous videos. So in this one we'll focus on specific details of the most common ones that we have on the market. They can be broadly classified into those that are non-selective COX inhibitors and those that are COX-2 inhibitors, at least for the dog. On this slide we have the name and the trade names or market names that as you will find them on the market. The ones ending on COX-6 are probably the last ones that came on the market, and they have a really wide margin of safety compared with the non-selective ones, at least when it comes to being less ulcerogenic. If we start with aspirin, this is kind of the prototype of the whole group. It was originally discovered from the willow tree. Then Bayer took it on and made it into a miracle drug that has been for so many decades, at least to treat fever and general pain. It's a kind of a weak anti-inflammatory. We would need a very whopping dose to get a good anti-inflammatory action. As you can see, it's mostly used to treat fevers and mild somatic pain, and really the biggest use, at least in humans, is for its anticoagulant action. Unlike the other NSAIDs, it blocks cyclooxygenase in the platelet in an irreversible way, so that platelet is really no longer functional. The other NSAIDs will do it in a reversible way, which means that when they disappear, the platelet recovers its ability to bind and form clots if necessary. If we look at the doses necessary to obtain this antiplatelet action, they are about 3 times lower than the regular dose, which provides analgesic and antipyretic effects. Now, the other consideration with aspirin is the cat. This is actually the only NSAIDs together with meloxicam that can be used long-term in cats. But if you look at the interval between doses, instead of 12 hours like the dog, we have to space them every 2 days. It turns out to be the same dose, between 10 to 20 milligrams per kilogram, but we have to give it every other day in the cat. So if we put this in practical terms, this would be about a baby aspirin of 80 milligrams every Monday, Wednesday, and Friday, and you basically skip the weekend. Now, the other thing about aspirin is that compared with other NSAIDs, plain aspirin on an empty stomach can cause a local burn in both dogs and cats. So you probably don't want to, and the other thing is you don't want to use an enteric-coated preparation from humans in dogs either. They have been shown to basically not work because our small animals have a shorter GI tract compared with humans. So ideally, if you want to use aspirin, you want to use a buffered aspirin, and that will prevent that, as I say, that acid local effect of the aspirin, which is actually different from the systemic effect of the prostaglandins, which will happen anyway regardless of the type of formulation. Now, if you were to put your animal on long-term aspirin, which is probably not a good idea if you can use Rimadyl or meloxicam, the things that you probably want to tell the owner are to watch out for signs of GI upset like vomiting, anorexia, diarrhea. So if those would be kind of the early indication that you want to stop the medication and probably do some further tests to see if you're causing some kind of adverse effects. And it's probably going to be, you also want to tell them that it's impossible to predict which animal will develop gastric complications, particularly ulcers. But if you see any of those signs, you can always stop the medication. And what you can do is put the animal on misoprostol, which is a prostaglandin analog that kind of replaces that prostaglandin which the NSAID is suppressing in the stomach. So if we move on to another NSAID, flunexin, this is the trade name is Banamine. This is kind of the exception to the other NSAIDs because it's probably the only one that alleviates visceral pain related to colic. All the other ones do pretty well with somatic pain, but are not so effective when it comes to relieving visceral pain. We already mentioned this other property for all the NSAIDs, but Banamine is definitely the perfect example of a drug that has a very short half-life of 3 to 4 hours, at least in horses and cattle, that you only need to treat once a day because basically it accumulates at the site of inflammation between 4 to 5 times more than the concentration that is also found in plasma. Now, the one thing is that even though you can still give it in small animals, there are many veterinarians that think it's very ulcerogenic because it has a very short half-life. Because it has a very short margin of safety in small animals, and because of that reason, they rather stay away from it, and they rather use other alternatives instead of using flunexin. What I can tell you is that it's also widely used by many other veterinarians in dogs, and you will see that it's recommended for up to 3 days in some cases. So what I'm going to do here is I'm going to show you a study in dogs and let you decide for yourself whether you would use it in cases of parvoviral infection in puppies, and I'll tell you what I would do at the end. When a puppy comes with parvo infection, it's usually the endotoxic shock that is ultimately going to kill that puppy. And flunexin is kind of unique among the other NSAIDs in that it has an anti-endotoxin effect, because basically it inhibits the bradykinin, which is one of the mediators that causes most of the vascular changes and the ischemia on those tissues during the endotoxemia. So if we look at this study, they had 12 dogs and they made 3 groups, and the first one was giving the E. coli endotoxin at times 0 and 24. They had another together with flunexin at times 0 and 12 hours. They had another group of 4 dogs that was given the endotoxin alone, and they had a third group that was given flunexin on its own. Now all the animals, they were anesthetized for 3 days and then they were euthanized, and in the meantime they were taking blood samples and urine samples, and they did a complete workup. And at the end of the study, they basically killed all the animals. They did a full necropsy to look at all those organs and to see what type of lesions were present grossly and by histopath. So if we look at the results, basically the first thing that we find is that all those dogs that received the endotoxin, all of them except for one died within 24 hours of the first injection. They all became really sick with diarrhea, vomiting, lethargy in 1 hour. That diarrhea was hemorrhagic in just a matter of several hours. They became fever. They had high fevers. They became hypothermic, comatose, high packed cell volume. Their protein levels went up, and basically they died. So this is what you will see with endotoxin on its own. Now, on the group that was given flunexin, all these signs they mentioned took place, but were much less severe. They also happened, but they were mild in comparison with the group that didn't receive flunexin. They had diarrhea, vomiting, lethargy. The diarrhea was only hemorrhagic in one animal. And as I say, the animals, there were no changes in kidney function. The BUN, the creatinine were normal. The urea, the creatinine never changed, as I say. And the changes in packed cell volume, protein, albumin were very small, and neither of those animals died. And basically, the final group, which is the one that received flunexin, there were no changes in anything. Everything was within the normal limits, and the animals never developed any clinical signs. So if we take a look at the endogenous creatinine clearance, which is basically an indicator of the renal function before and after the animals were challenged in their respective groups, what we see here is that all the groups had decreases in the mean creatinine clearance when compared with their initial clearances. However, only the changes in group 2, which is the one animal that survived to the endotoxin, because as I said before, all the other 3 animals had died in the first 24 hours. So that animal was significantly lower at 72 hours. So what this is telling us is that flunixin is basically protecting the kidney from the effect of the endotoxin, even though flunixin on its own appeared to also affect or lower the function of that kidney. So the one thing that was surprising in this study is that when they did the post-mortem examination in 3 of the 4 animals in the group with flunixin and the endotoxin, they found multiple ulcers in the gastric mucosa of these, and these were not found in the dogs that were given the endotoxin only. So I guess that those dogs that had just the endotoxin had probably enough to worry already with the profuse hemorrhagic diarrhea coming from the intestine, which killed them anyway. So basically what we see here on this image is one of those multiple partial thickness ulcers in the pyloric region of the stomach, and that was obviously induced by the combination of the endotoxin and the flunixin treatment. They attribute these ulcers to the ischemia on that gastric mucosa by not producing the prostaglandin, and the combination of that and the shutdown of blood flow from the endotoxin. So the conclusion from this study that we can draw is that the flunixin is lessening the effects of the endotoxin in terms of the clinical signs, the hematological changes, and the renal and hepatic function, and is also obviously protecting from the lethal effects of the endotoxin. Obviously, all of these are beneficial effects. By contrast, the side effects are that it will cause the gastric ulcers in face of an endotoxemia, which is obviously an adverse or detrimental effect. And so I guess what we would have to conclude is that we have to weigh the beneficial and the detrimental effects to make a decision. So as I said earlier, my personal opinion for the puppy would be with parvo would be that flunixin would take a second seat if I can use corticosteroids like dexamethasone. That would always be my first choice. If for whatever reason I cannot use a corticosteroid, then yes, I would definitely use flunixin, because those ulcers are not life-threatening and the benefits outweigh the downside, as we just saw in this study. But as I just said, there is probably no need, because most people would probably have dexamethasone in their clinic, and that would always be a better anti-inflammatory option. The other thing I should probably say is that those dogs that develop ulcers, they were also given the endotoxin at the same time, and in the group that was given flunixin alone, nothing happened. So if you had animals with other conditions and you give flunixin up to 3 times, as the label indicates, it's probably going to be okay. So going back to the slide of the flunixin, even for horses and cattle, the label always tells you not to give for more than 4 or 5 days, because beyond that duration, the risk of developing gastric toxicity goes up. In other words, we would be walking in uncharted territory. Now, for cattle, one of the main indications is bovine respiratory disease every day for 3 days, together with the appropriate antimicrobial. These may obviously be quite important to reduce fevers and help that animal reduce the inflammation process which is taking place in those lungs. Another indication in both horses and cattle, which appears to be unique for flunixin, is to control the inflammation in endotoxemia cases, and the doses to achieve this effect appear to also to be much lower than the regular ones for inflammation. And the reason being, as I just mentioned for the dog, is that flunixin is a bradykinin inhibitor at those lower doses. Now, because flunixin is approved for cattle, we should probably say something about the withdrawal time for meat and milk. If you use it according to the label instructions, which are about 2 milligrams per kilogram by the intravenous route, you cannot really slaughter that animal for 4 days, and milk should be discarded for 36 hours. However, this is only for IV use, so if you were to use it in an extravascular route, say intramuscular or subcutaneous, this is considered an extra label use. And as you can see here, the Food and Animal Residue Avoidance Data Bank recommends a 30-day slaughter withdrawal interval and 72 hours for milk instead of 36 hours. So the reason is that basically flunixin appears to be highly irritating when it's injected intramuscular, and it may cause a muscle damage, and this could create deposit of that drug, which prolongs the absorption into circulation. So this is really a limitation, but basically you cannot use it IM or subcutaneously, as I say, because of that reason. With IM administration, it's already difficult to establish pharmacokinetic data between different studies. With subcutaneous, it was almost impossible. So they don't even bother speculating, and as you can see here on this table, they don't even attempt to show a withdrawal time. So if we move on to the next one, this is carprofen. This is another selective COX-2 inhibitor. It was actually the first one to come on the market of its kind. Very safe in dogs with a very wide margin of safety. And actually, when they did toxicological studies in dogs, they found that 5 times the recommended dose for 52 weeks didn't really cause any gastric lesions. However, when they did further studies and they used 1 time, 3 times, or 5 times the label dose, they found that there were the occasional animals that it would cause gastric lesions. So even though it's very safe, it will always be the occasional dog, as I say, that will develop gastric signs of vomiting, diarrhea, inappetence. So when they started selling this drug to the entire market, they obviously had a much larger population of animals exposed to the drug, and by doing so, they also started seeing what the adverse effects of the drug would be, and the most common ones, as I say, in less than 2% of the animals were vomiting, diarrhea, anorexia, and there were also a very minor number of dogs, as you can see here, 5 in 10,000 dogs that develop liver failure. This was an idiosyncratic reaction. But obviously, if it is your dog, it's a big issue. What they started doing was to suggesting monitoring liver enzymes beginning at 40 days after you initiate the medication, because if something is going to happen, you're probably going to detect it that early as soon as you put the animal on the medication. Now, to wrap up the talk on carprofen, we should probably say that for single administration in cats, like surgical or trauma, they're even licensed for use in other countries. The problem is that for prolonged use, it's not a good idea in cats. In fact, there are studies, that they have found that carprofen is even more effective providing analgesia for castrations and ovariohysterectomies than some opioids like buprenorphine. The cats require less rescue analgesia when it was given before the surgeries, So this is another thing that you might want to use on your cats if you're only going to use it once. So the final one that we should probably say a few things is meloxicam. This is also a preferential COX-2 inhibitor. It's approved for chronic pain in dogs and not cats, at least in the US. However, this is actually the only one together with aspirin for chronic pain in cats. So a lot of veterinarians use it in an extra labeled manner, obviously in cats. If you use the right dose in cats, it's quite safe. So it basically comes down to adjusting the daily dose and making sure that you don't go overboard, because if you do, you will definitely poison and kill that cat. It comes down to it comes as an injectable and as an oral suspension, and now they came up with a transmucosal spray, which is quite convenient because all you have to do is squirt it into the gums of the mouth, and there you go. So as you can imagine, the most common adverse effects, as we've been saying all along, are GI distress, vomiting, anorexia, diarrhea. You may need to stop the medication and see what's going on, because as I say, the potential for causing gastric ulcers is always there, and that would definitely require specific treatment. If you notice, the dosage that is recommended for maintenance in cats is about half the one in dogs, 0.05 milligrams per kilogram, and they suggest that if you can identify those cats that can be managed with lower doses, you might want to try. What do they mean by that? Well, basically, if you read their statement closely, I think they mean to look for signs like willingness to jump, looking for overall activity on that cat, less stiffness. It's more difficult, obviously, to assess the degree of arthritis in a cat as compared to a dog, but that's pretty much, I think, what they're looking for. So this was my final slide. I think we have covered a lot of ground. So I think I'm going to dismiss you here, and I'll look out to see having you on future videos. So take care, and bye bye for now.